So, welcome to our introduction to nursing research. I'm Mr. Miguel del M. Morales, your professor for today. So, this is the NCM 111 Nursing Research. So, what is research? This is more on the scientific inquiry to knowing the truth, and later we'll have a lot of meaning. For our student objectives, describe why research is important in nursing profession and discuss the need for evidence-based practice. Identify several purposes and characteristics of research. Discuss the role of nurse research and describe historic trends and future direction of nursing research. How do they do it? You may ask. How can Florence Nightingale going to be the mother of modern nursing? How could she develop the theory of environmental theory? How our technique in IV insertion changes? How our turning and positioning can prevent pressure injury? Hmm. How is diet related to the high risk for hypertension or atherosclerosis? So students, may I ask you, what are these questions lingering on your mind that needs to be answered? What are the questions? And how can we solve it? Research is based on the word searcher or seek or search. As researcher, we are the seeker of truth. It's a studious inquiry. It's a process that needs to be followed in a step-by-step manner. It's very honest investigation. Though your hypothesis is null or alternative, you accept or deny the null hypothesis, you should be honest. Not only to your respondents, but should honest to yourself as investigator. Research, all of the research should have purpose. Why do you conduct this research? What is its significance to our profession? It's very vital because purpose is when and also can be used as motivation to continue the research. Contribute to the present body of knowledge. Could, could you want to have your own theory? Could you want to have your own model that can be used and to be a legacy for you in the nursing profession? Your research should contribute to the general body of knowledge. And last, research is to solve the existing problem, should narrow the gap of nursing practice, nursing education, nursing research, clinical nursing. Research should bridge the gap between all of those problems. Paradigms. There's two paradigms. There's positivists and constructivists. Positivists is the reality exists. There's a real world driven by real and natural causes. It's more on a rigid numerical data. It's more on statistical analysis. Constructivist, the reality is multiple and subjective, mentally constructed by individuals. It's more on the qualitative analysis. So, in coming up with your research in the end of this term, you should identify, is it in the positivist philosophy or is it in the constructivist philosophy? Is it the positivist philosophy that the real world is truth, that there is truth already, but constructivist, we challenge the truth and we create the truth. Nursing research, however, is a systematic inquiry. Again, it follows a step-by-step process. It's very empirical and it follows the scientific processes. Develop trustworthy evidence. Why? Nursing is an independent profession that needs their own evidences to care for our patients. And it should be trustworthy. How to have a trustworthy evidences? There should be a repetitive, consistent outcomes of your research. It should have the same effect to our patients. Nursing research encompasses nursing practice, education, administration, and now informatics. Nursing research affects nursing practice through what? Through policy changes, through development of new clinical pathway guidelines. In education, we challenge the modalities of teaching. We should seek if the new modalities of teaching is effective. In administration, how we deal with our staff and our patients. In informatics, if this information, if this system contribute to the knowledge of our students and safety of our patients. The purpose of research, nursing research, is first to assess the nursing problem or phenomenon. We should know first, we should be aware what are the problems that infesting our profession. The staffing, why there's lack of staffing in a clinical area. Why there's decreasing enrollment in nursing schools. We should assess the nursing problem and the phenomenon itself. And it's also its purpose, find ways to improve nursing practice and patient care. Robotics. Is robotics can replace, or robots can replace human nurses? Is humanoid nurses could be replaced by a human nurse? So that is one of the purpose of research, for us to know if it's effective or it should be changed or it should be improved. Other purposes, initiate and evaluate change. You may ask, why it is every 2 hours of turning and positioning? Can we challenge it? Can we change it in Q4? Q6? How can you answer this? Through research, experimental research. And last, take action to make new knowledge that is useful in nursing, such as new models of research, new theories, new insights, new hypotheses can be challenged. Even challenge the existing theories. Is it applicable today in times of pandemic or in the present state? You may want to know. Through what? How? Through research. History of nursing research. In 19th century, it's the Florence Nightingale. She was coined as the mother of modern nursing and the first nursing theorist. Her theory is the environmental theory. In 1900s, nurse research in education. In the education part, they initiate the nursing research. It's more on in the universities. In 1950, there's funding and advanced nursing practice to the nursing research. Now, they're not only confined in the universities and colleges, and more on dealing now with evidence-based practices. In 1960s, there's practice-oriented research. Practice-oriented research is more on the experimental research. If we place the patient in a phototherapy, is there's decrease in bilirubin or there's no changes. 1970s, improving client care. Now research is not only um, dealing with improving the practice, but now it's centered to the safety and quality of client care. And 1990s, the birth of evidence-based practice. Future direction of nursing research. Continued focus of evidence-based translational research. Evidence-based research is more on due to rigorous researches, due to experimental researches, and it's proven. Thus, it has that recommendation to change the current practice and adapt the new practice of nursing. Translational research, however, is this conceptual and results of your study is translated to practice and application. Stronger evidence through confirmatory strategies. All of our results in our research this semester can be an evidence, and it should be confirmed through what other results of different researches. Thus, it makes the nursing research more stronger, and the foundation is very steady. Continue emphasis on systematic reviews. Later we'll discuss systematic reviews. Expanded local research in healthcare setting. May I ask you, students, do your local health government have a research arm? Do your province has its research department? Why? Because local research in healthcare setting is very important because your population and sample of your research affects your results and your recommendation. Thus, it's not only the responsibility of the researcher, but also it's also a responsibility of our stakeholders, such as the government, such as the private institution. Expanded dissemination of research findings. In research, there's different phases. It will not end to the results and discussion. The end is dissemination and application of research findings. How? We will disseminate this through what? Through social media, through conferences, through seminars, and even the application of your own model or you're testing your own theory. Increase focus on cultural issues and health disparities. In the future, it's more appealing for us to check the healthcare practices of Batangenians, the health disparities of different uh, uh, countries or in different cities or municipalities here in Batangas province. Are there different healthcare practices that could affect their health? Clinical significance and patient input. This is a great challenge. That in research, we should have collaboration not only with our colleagues, not only with ancillary staff, but in collaboration with our patients. Evidence-based practice. It's the best clinical evidence in making patient care decisions. These evidence are based on research. So there's three components. First is the clinical expertise, best research evidence, and the patient's preference. Thus, it composes the evidence-based practice. In clinical expertise, as you scan, read, comprehend, and analyze all of the researches, it should be focused on their specialization and specialty. If it's wound care, see the, the Association of Wound Care Nurses. If it's ORNAP, it's more on the OR guidelines and clinical pathway guidelines. And the best research evidence. The best research evidence is based on their results. What are the outcome of their results? And last is patient preference. Yes, there's clinical expertise from clinical expert, and there's best research evidence. However, if it's not safe to the patient, if it's not preferred by the patient, it can be accepted as EBP. Features of evidence-based practice. It's a clinical problem-solving strategy, and it minimizes decisions based on customs, authority, opinion, or ritual. Identifies the best available research evidence and integrate with other factors. So minimize decision based on customs, authority, opinion, or ritual. There are practices that's very traditional. Okay, if you have boil or pigsa, what we currently do or commonly do, we place amoxicillin and we eventually forcefully puncture it to remove the pus inside. However, is it evidence-based? Is it safe? It's also painful. So please do your research. Is taking antibiotics a best evidence? Or doing puncturing it and forcefully removing all the pus in there is safe? So that's the power of evidence-based practice. Advantages of evidence-based practice. Offers a solution in improving healthcare quality in current cost-strained environment. Provides best possible care to the most people with the most cost-effective use of resources, and provides an important framework for self-directed lifelong learning. In evidence-based practice, it's more on not only dealing with the nursing care, it's not only dealing the patient safety and quality of service, but you should also take in consideration the cost of care. Yes, that's best evidence, that's preferred. However, it's costly. So, do you think that it will be used or utilized if it's costly? So, in evidence-based practice, we are more focused in a safe, quality, and low-cost practices. Steps in evidence-based practice. First, ask clinical question. What's the problem? Let's see. Search and collect evidences. Appraise and synthesize. Integrate in the clinical practice and evaluate the effectiveness. Level of evidences. The lowest level is the opinion of authorities. Second is single descriptive qualitative physiologic studies. Fifth is systematic review of descriptive qualitative physiologic studies. Single correlational observational studies. single random trial test and single non-randomized trial, and systematic review of RCTs or systematic review of non-randomized trials. This is the level of evidences. If you do your searches, the lowest level of evidence is opinion of authorities, and the sixth is single descriptive and qualitative physiologic studies. So the hierarchy is until we have systematic review of the random control trials. It's randomized and there's control. So there's no bias there, and we are seeing the phenomenon or the instance as objective as possible. Framing the research question is PICOT or problem, patient, population, I is intervention, indicators, comparison, O is outcome, T is type and time of study. Framing the research question. Frame the question. Plan a search strategy. Narrow your search. Comparison, outcome, and time of type of study. And filtering the evidences. As example, does hand washing among healthcare workers reduce hospital-acquired infections? The problem is, or patient or population is hospital-acquired infection. Our intervention is hand washing, so we will compare it to no hand washing or alcohol-based hand rub, and the outcome is reduced infection rate. So in the natural language, we can use other words such as hospital-acquired infection may be searched as cross-infection or cross-contamination. Intervention may be hand washing, hand disinfection, hand rubbing, and hand disinfection. The importance of nursing research. Why nursing research is important? There should be a strong evidence for action and decision. In the future, you will be chief nurses. In the future, you will be supervisors. And your decision should be based on facts and evidences. Thus, do your research. Deliver high quality of care. As researcher, should not be confined and satisfied on the status quo. Should challenge the 100% because you want always and always to deliver a 100% quality of care. So through what? Innovation, improvement, and challenging your own system. Elevate the nursing standards. Yes. Through research, we elevate our profession. Through research, we became independent in our practice. Through research, it gave us our identity. Contribute to the body of knowledge. So the importance of research. Every researches should contribute to the current knowledge or it can change the current practice. It is also a personal and professional growth and development. Through what? In personal development, you try to practice discipline. You try to practice patience because again and again, research is a rigorous process that takes a step-by-step procedures. There's no shortcut. And professional, if you are in love with research, you can climb the ladder of leadership and you can climb the ladder of your career. as a practicing nurse, a nurse researcher, nurse educator, a master's degree, and also a PhD degree in the future. The purpose of research, again and again, is to identify, to describe, to explore, to predict and control, and to explain. In identification, in qualitative research, you want to know what is the feeling, or what is it to be the hospital bed. That is more on the qualitative part. Do you want to identify, to describe? Describe what? You describe the phenomenon. Live experiences of cancer patient. You want to describe what's happening today in pandemic. In exploration, it's more on how we understand the situation, how we change the situation through the current practices. Predict and control. Through research, its purpose is for us to predict. Ah, if we give this medication, there's a prognosis or poor prognosis. If we will not give this medication, there will be good prognosis. On that sense, we give a much more empiric and evidence-based decision making to our patients and relatives. And last is to explain. Research explains a phenomenon. Research explains a process that needs to improve or needs to be modified. Quality research. A quality research characteristics. What are the quality research? As you have been bombarded with all of this online shopping, so may I ask you, what are your criteria of buying an item? It's like also the characteristics of quality research. First is there's a sound methodology. Should know what is the methodology. Should decipher what's the right methodology on that title. Such as, I want to explore the the lives of COVID positive patients, the lives of COVID positive nurses. It, could it be a quantitative, or can I use a qualitative? So on that moment, on that point, you should decide what will you use. Relevant solution in present issues. Quality research needs to solve an issue. It should be analytical through data gathering until data analysis. Sir, is qualitative also have analytics? Yes, of course. Data gathering per se, that's a painstaking process. An interview and doing your transcribing is a data gathering with analysis. And thematic analysis is another level. Development of evidences that may be helpful in predicting future occurrences. That I've already discussed. If you have the data, a lot of data regarding a disease and its treatment, we can predict, is this medication or this nursing care could help the patient to survive in the future? So that's the power of research. It should be empirical. It should be first-hand basis. The information should be first-hand. The first-hand means that it is through our informants. honest and with respondents' full participation. The, as to have a quality research, you should have a rapport, should have connection with your participants. Replicability. Replicability is your research can be reproduced and your outcome or your research results and analysis could be used across the nursing profession. Innovative approaches. Now, in this time of pandemic, research should not stop. We should adapt on this situation. Through what? Through the use of virtual platform, through the use of other modalities of data gathering procedures. Properly recorded, documented, and disseminated. I want to reiterate that the end of your research is not the results and discussion. It's not the recommendation. It is you disseminate, you discuss it, and you implement your results and recommendations. Roles of nurses in research. You may ask, sir, what are roles in research? I'm a researcher, or based on this PowerPoint, we are the producers. We produce knowledge, we generate knowledge because we are the seeker of truth. And we are also the consumers of the results, recommendation, guidelines, policies, implementation. And these are the two roles that's very vital as nurses across disciplines. You're a producer and also you're a consumer. Let's check if you have learned something in this session. Can you describe research, why it's important in nursing profession, and can you discuss the need for evidence-based practice? You may ask, what are the purposes and characteristics of quality research? You may ask also yourself, what are the roles of nurses in research participation? And last, can you plot the historic trends and future direction of nursing research? To that, again, love research, live by it. Oh, grab the opportunity, value your research, and empower others. Thank you.